Hello, ma'am. Good morning. So my name is Dr. Saha, one of the PACES candidate here today. I've been asked to examine your tummy. So what I'm going to do, I'd like to have a very good look first, feel and listen to your tummy and tapping your tummy. So do you have any pain right at this moment at your tummy? No.
No.
All right. So during this procedure, if you feel any kinds of pain or discomfort, just let me know. I'll stop at that moment. Is it all right? Yes, my dear doctor, listen very carefully. Immediately after entering the room, the station 1 abdomen, you already know what the steps might that they need to follow and the approaches that you already learned. The liver abdomen, spleen abdomen, and the renal abdomen. So liver, renal abdomen, and the spleen abdomen. And now the new things are the colon abdomen. Yes, my dear. So now listen very carefully. Already you've gone through all the steps that what you need to do. Yes, you entered the room, that you have seen this, examined this lady's abdomen. So definitely the diagnosis is very close to the lady. And of course, you need to know about the steps, the liver, then the renal, then the spleen, then the colon abdomen. So let's start our examinations here. Next, we'll discuss later on. So yes, my dear doctor, immediately enter the room that you need to do the jib bundle packs. G for the good greetings, introduction, instruction, pain, position, and poser. You already have done up to the pain management, now the position. So position is lying flat for the abdomen examinations. And poser means the exposer. You need to expose her. You need to tell her, ma'am, would you please mind? Would you just to expose your tummy? Is that all right? Yes, all right. Thank you very much. So immediately after the exposure, the jib bundle packs, my dear, you need to start the examinations now. This lady is now ready to start your examinations. So yes, my dear doctor, immediately after just doing the jib bundle packs, that you have seen that lady has got the 2 scar marks here. The right one scar, that is a laparotomy scar, right-sided upper abdomen, right upper quadrant. There is a scar. And also there is another scar for laparotomy, another scar below the umbilicus, the midline scar, and also a bag, that is the ileostomy bag. So what does it mean? We'll discuss later on, but let's start the examination starting from the hands first to exclude the liver, renal, and the spleen abdomen altogether. So ma'am, could you please just do like this for me? Yes. I'd like to see the hands first. Yes. Yes, you need to see the clubbing the way that I'm seeing, observing her. Yes, clubbing, and also the leukocytia. And she doesn't have clubbing, no leukocytia. So could you please show me hands like this? So you're looking for clubbing here. So no clubbing, no leukocytia. You can compare with my own hands. And now turn the hands like this to see the pulmonary erythema. So she doesn't have the pulmonary erythema. And also the Dupuytren's contracture, so no Dupuytren's contracture. So can you just spread your fingers and cock up your wrist back and just hold it here to see the flaps. So she doesn't have the flaps. No flaps here. So immediately after the hands examination, then on the forearm that we have found that some of the skin bruises and some of the skin purpura for the steroid evidence. This lady is on steroid on the right hands. Now on the left hand that I've seen, yes, he has got also some skin thinning and also some of the bruises on the left forearm. So these are evidence she is on steroid right this moment. So immediately after the hands examination, that you need to look for the anemia. Just look up for me. So no anemia. Now look down, look down. No jaundice. Now stick your tongue out for me, ma'am. Tongue up. Now show me your gum. Yes, no gum hyperplasia, no anemia, no jaundice. So immediately after that, the upper chest, that you're looking for any spider nevi, that we have not found any of the spider nevi on the front. And you need to see onto the back as well, no spider nevi. Means a no stigma of the chronic liver disease. So immediately after that, the abdomen examination, that the inspection that we are looking here, the abdomen, that we can see there is a scar. There is a rooftop and the right-sided scar that you can see here. The scar is here. So this is the new right-sided laparotomy scar. We call it the new liver transplant scar. So this is the new liver transplant scar. So this is nothing but evidence of liver transplant. So we can see there is a scar on the right-sided laparotomy scar, and this scar is specifically the new approach of liver transplant. Usually the liver transplantation is done by a rooftop Mercedes-Benz scar. There is a scar here, there is a here and the scar. So inverted Y-shaped, you can say. But the new approach is through a small scar stem and the right upper quadrant scar. So this is, we call it the new approaches of the liver transplantation. So this is the new scar that a candidate should know, a doctor and you doctors should know about it. This is the scar. And this scar is a liver transplantation scar rather than a Mercedes-Benz scar that you already have seen. So yes, my dear, so this lady underwent a liver transplantation. Now we have seen, and we can see a very close approach of this scar. Yes, closely there we can see, you see the right-sided rooftop here, and the scar is going right side. Yes. So this is the new approaches of liver transplantation. Immediately after that we have seen there is a scar mark here, midline laparotomy scar. So you can see very closely a little bit so that we can understand. Yes, closely. Is a midline laparotomy scar, lower abdomen laparotomy scar. So midline laparotomy scar, along with the right-sided colostomy bag, this is an ileostomy bag, I should say. This is an ileostomy bag here. So yes, this is the ileostomy bag on the right iliac fossa. So definitely the ileostomy bag and the laparotomy scar, what does it mean? It does mean that this lady underwent the colectomy, and the ileostomy is done after that. And this colectomy is nothing but the lady having the complications of ulcerative colitis that is complicated by the perforated ulcerative colitis that was needed to go for colectomy. And this colectomy resulting, there is an ileostomy here. So the colectomy done, ileostomy here. So this is nothing but the diagnosis. This lady has got the ulcerative colitis. And this ulcerative colitis is strongly associated with the primary sclerosing cholangitis. And this primary sclerosing cholangitis is an important cause of chronic liver disease, and that leads to the liver damage. Cirrhosis means a chronic liver failure, and that necessitates to her to go for the liver transplant. So this is basically the things that we have learned from this just by having an inspection, the diagnosis. Means this lady having the history of the inflammatory bowel disease in the form of ulcerative colitis, complicated by perforative ulcerative colitis, acute colitis, and that was needed or necessitated to go for her laparotomy approach to do the colectomy and having an ileostomy. And also later on she developed the chronic liver disease, and that needed for the liver transplantation. Immediately after that, the laparotomy scar that you can see the right-sided colostomy bag here. So yes, so there is the bag here. So we need to examine her for the liver, then the spleen, then we need to examine her. So I need to examine her liver first. I need to tell her, take a deep breath in and out for me. Take a deep breath in and out, once again, in and out, once again, once again, once again. So liver is not palpable, not enlarged, that you can tap. And you need to do the upper border of the liver dullness as well. So this is normal. So liver is not palpable, not enlarged. And also immediately after the liver, then you need to put your hands for the spleen as well. Take a deep breath in and out. Once again, once again, once again. So definitely the spleen is also not enlarged, not palpable. You need to turn round onto the right hand side. I'm not doing that one, just to show you. This is tympanic sound. Immediately after that, you need to palpate this leaves, kidneys as well. And the kidneys are not palatable, not the palpable. And after the kidneys, then you need to put your hands for the inner bladder as well. Immediately after that, you need to put the hands for the PACES, and showing that the tympanic sound. And these all are tympanic, so the side is absent. Now immediately after the percussion, there is the auscultation. Then you need to put the stethoscope onto the bowel. Put the stethoscope onto the bowel for the bowel sounds. And then the turn round for the renal bruit, and over the epigastric region for the venous arm, which is a feature of portal hypertension, which is absent. So every features are normal here. There's the end of auscultation here. Immediately after that, you examine the abdomen, my dear. You need to tell her, because she is a lady, so you need to keep the dignity. So you need to cover her, yes, the abdomen, because you finish the abdomen examination, you feel it. And then you need to tell her that I need to see your legs. Yes. Do you have any pain in your two legs? No. All right. So to see the leg edema, so she doesn't have the leg edema, the important negatives. And also you need to tell her, just could you please sit forward for me? Yes, just to see the back of her, to see the sacral edema. And also always look for any of the scar marks, anything else. Always, my dear, front and back, you need to inspect. Is there anything else that you found, my dear? Be careful about it. It's important tips and tricks. Then after that, you feel that the leg edema that I have seen, that you need to examine the neck for the lymph glands. So you need to feel the necks for the anterior chain, for the posterior chain, for the supraclavicular lymph glands. And lymph nodes are not palpable, not enlarged. Immediately after that you finish, then you tell her, just lie back for me. Then you just cover her. Yes. And tell her that if you finish that, you finish your examination, tell her, ma'am, you have done really excellent. Thank you very much. Yes. So if you finish that, you finish your examination, you need to wash your hands, my dear. And then you can take the stethoscope in your hands. So yes, take the stethoscope in your hands, then come forward and look into the both eyes of the both examiners and start your saying, my dear. You need to tell that I would like to complete my abdominal examination to look at the hernial orifices, genitals, and digital rectal examination. I'd like to finish my full examinations to see the observation chart, especially to look at the pulse, temperature, respiratory rate, blood pressure, and oxygen saturations. And I'd like to do the urine dipstick for the sugar, protein, RBC, and nitrites. So yes, my dear doctor, saying these three important bundle packs, it does mean that you finished your examinations and you'll get the full marks, the satisfactory marks in the examination section. Now the presentations, my dear. I'd like to say the presentation should be smarter way so that you can get the full marks in your hands, my dear, because you need to satisfy to the examiners. The presentation sometimes you should do in that way that I'm saying, my dear. If you do that, you'll get the full marks definitely. Sometimes it happened to the candidates. You've done some of the mistakes during examination, some of the systematic ways that you've missed something. So you missed something, you did some mistakes during dealing with the patients, during examination, the full procedures. But yes, my dear, if you do very well in the presentation skills, if the crossing against the examiners and giving the viva with the examiners, there is a high likelihood to get the marks to full marks, 20 out of 20, my dear. So you need to satisfy the examiners. So yes, my dear doctor, you need to present the way that I am presenting. So my clinical diagnosis of this pleasant lady is liver transplantation, as evidenced by there is a right-sided there is a liver transplant scar, there is a new approach, the new scar. But without evidence of liver enlargement, without evidence of stigmata of chronic liver disease as evidenced by the absence of leukonychia, absence of clubbing, pulmonary edema, absence of dubitaceous contracture, absence of spider nevi altogether. So yes, she underwent the liver transplant without evidence of chronic liver disease and also without evidence of any decompensation like absence of jaundice and ascites. And also I have found this lady also has got a disease that the ulcerative colitis as evidenced by right-sided ileostomy bag that is attached onto the tummy or abdomen. Along with it, there is a midline laparotomy scar. That does mean that she underwent colectomy. And that ulcerative colitis was being complicated by the perforated ulcerative colitis, and that was necessary to do or to go for colectomy. And that is evidenced by there is a midline laparotomy, lower laparotomy scar, as well as the ileostomy bag that is fitted with the right iliac fossa. And now the examiners may ask you the different questions altogether, or maybe that you should proceed with the presentation that I'm saying, my dear doctor. Yes, now the liver transplant and the relationship with the ulcerative colitis. Yes, my dear doctor, you need to tell, sir, this liver transplantation was done due to the chronic liver disease or maybe the end-stage liver disease. And this chronic liver disease, the underlying etiology, I think, the primary sclerosing cholangitis. As evidenced by this lady also having the ulcerative colitis. So ulcerative colitis along with the chronic liver disease. So I think the most likely underlying etiology of the chronic liver disease was or is the primary sclerosing cholangitis. And I have seen this lady also, she's on steroid as evidenced by the steroid evidences or stigmata, the bedside that is evidenced by the skin thinning, easy bruising and some of the steroid purpura. But I have not found any of the evidences of any complications from the immunosuppressive drugs and any other evidence of immunosuppressive medications. So putting all them together, this lady has got the chronic liver disease that was underwent, or end-stage liver disease that underwent for the liver transplantation, that the most likely underlying etiology of the end-stage liver disease is primary sclerosing cholangitis, and also she has got a disease that is the ulcerative colitis. As evidenced by, there is a laparotomy scar, that does mean that she underwent the colectomy and the ileostomy bag. And she's on steroid without any evidences of chronic liver disease, without any evidence of any other complications from the immunosuppressive drugs. Yes, my dear doctor, I'd like to discuss a little bit further more for the inflammatory bowel disease. One of the most important talks that you need to know, my dear, that is the extraintestinal manifestations of inflammatory bowel disease that are given according to the mnemonics, my dear, A, E, I, O, U. There's a vowels, you can remember. So A for arthritis. So the lady may be arthritis. And E for, yes, erythema nodosum. So erythema nodosum, yes, in the shins especially. And then I for eye, yes, eye, with the episcleritis. And O for osteoporosis and U for uveitis. So while examining here, that you can see the features of extraintestinal features of A, E, I, O, U. So the arthritis, E for, yes, that is erythema nodosum, I for episcleritis, and O for osteoporosis, and U for uveitis. And also, most important that you need to know, for the Crohn's disease specifically, the C for, yes, and D for, C for clubbing, and D for derma, that you can remember, the pyoderma gangrenosum. And ulcerative colitis, the UC, E for uveitis, more specifically with the ulcerative colitis, and C for primary sclerosing cholangitis, means the cholangitis. So what I'm saying, my dear, is because this lady has got the ulcerative colitis, so yes, she might have earlier the uveitis. So whenever you're examining the eyes, that you need to look for any of the features of uveitis, episcleritis, the features may be found with the red, painful red eye especially. And also C for cholangitis is a primary sclerosing cholangitis, my dear. And there may be a lot of questions that I'll discuss in another lectures regarding the primary sclerosing cholangitis. The examiners may ask you. But mind you, listen very carefully, one of the most important talks. This lady should be follow-up should be given, that the serious complications of ulcerative colitis, you need to remember, because ulcerative colitis itself is a risk factor for the development of colon cancer. As because the colectomy done, there is a less likely chances right at this moment in her case. And also another cancer, my dear, there is a primary sclerosing cholangitis association that leads to the cholangiocarcinoma. So we need to be following her whether the primary sclerosing cholangitis that leads to the cholangiocarcinoma or not. So that should be needed to follow up, should be given to her case. I hope that, my dear, this is a difficult case, I should say, a very difficult case to correlate in between that, the scars and having some of the findings all together. So my dear, listen very carefully that you need to know, putting all them together, the findings that we found, she's malnourished, she looked to be malnourished, having the features of the ulcerative colitis, having the features of chronic liver disease that ended up with the right-sided liver transplant, and that is evidenced by the chronic liver disease that is complicated by the primary sclerosing cholangitis. So ulcerative colitis, primary sclerosing cholangitis, that is the main reason for going for this colectomy as well as the right-sided renal transplant. I hope that, my dear, you enjoyed. Thank you very much. Thank you once again.